We have got some time available now for questions and answers. I'd like to invite people to come up to those microphones, if you'd like to queue up to the microphones on the floor. And before you ask your question, if you could just give your name, organization and country, and who you want to direct your questions to. So I think this gentleman here was first, and we'll then rotate around. Okay.
Thank you very much. I'm Robert Reinhardt from Toronto, Canada, and I'm a health policy coordinator within the Ontario HIV Treatment Network, and also embedded in the teams in Canada that are conducting cure research. So for Mr. Brink, and for all of you, really, I appreciate the great scope and broad display of involvement in these health system advances, and I was especially struck by the elegance of the way you presented the epidemiology of what's happening with Anglo-American, because it recapitulated for me a lot of the story that was told this morning at the plenary session by Dr. Karim, but within this particular industry context. And so my question is, you know, if we are really going to make the advances that are necessary, the other components that we all talk about at this conference are the long-term investments that are needed in new innovations, specifically vaccine and cure. So because of the business case that you've articulated, because of these horizons of life of mine, kinds of, you know, years of involvement in communities, isn't there not also a strong business case and an interest case to support the kind of research to complete that really engagement in the problem of supporting the research for these other innovations and that kind of support from the extractive industry? But basically, I really appreciated everything everyone said. Thank you.
Okay, Brian, would you like to answer that now, or do you want to take a few questions?
Absolutely. In fact, we do that. We've actually been doing it for quite a number of years within our communities. The most recent examples go around trying to find a vaccine for TB, which is one of the things showing huge promise, where they need to do clinical trials in communities with high incidence of infection. So we're talking a lot with ARS, who's an NGO involved in developing TB vaccine. That's just one example. Lots of other research opportunities and collaborations as well.
Okay, thank you. I'm going to go to the gentleman over that side now.
Thank you very much. My name is Clive Ingleby. I work for the organisation Voluntary Service Overseas. Our Regional AIDS Initiative for Southern Africa is currently running a programme for the widows and families of migrant mine workers in Lesotho, Swaziland and Mozambique. And my question revolves around that. It's really great to hear such good work, best practice being presented on the ground, actually at the coalface, no pun intended. But my question is around, what about the extended families? What about those, because many mine workers are migrants, and you've already said that you've got high incidence of HIV in the surrounding communities where mine workers will often have almost second families, but they leave families back at their home base, and they seem to me to be a comparatively neglected group at the moment. And whilst I recognise that it's not necessarily the responsibility of mine companies to care for people who are not in the immediate vicinity of the operations, I wonder, my question is around how much thought has been given around how you support the families who are way back in home countries, whose wives, children are also at risk of HIV and TB infection when the mine workers do return home, either at the end of their contracts or during periods of leave. Thank you.
Can I have a first go at answering that? It's hugely important, and it's part of sustainable mining to create a continuity between the workplace and labor-sending areas wherever they may be, and families. It's all part of what we do. One of the reasons for putting so much emphasis on the information systems is that those are cloud-based information systems. It doesn't matter where the person is, you can access those records, and it includes the entire family. The problem where many of those families are located is weak health systems in rural areas. And what we have to do is work together with government and with NGOs to find ways to strengthen the health system. One of the areas that we are busy developing actively at the moment is to put mobile diagnostic units out into those communities where we can actually actively go out and case find all HIV, TB, and also occupational lung disease cases to find for them the care, support, and treatment that they need. So this is stuff that we're very busy with at the moment.
Okay, any of my other panelists like to respond to that? Blair or Rob?
Yeah, I agree. It is an opportunity for us. I think we need to continue to work with the government on these sorts of initiatives and not just be thinking about the local region that we're in, but what is the broader picture. We're starting to get that sort of momentum with malaria. There's different programs with HIV ongoing, but for Newcrest at the moment, we're still largely involved in the malaria programs. There's a new primary industry malaria initiative that's being started up in PNG. So these sorts of broader initiatives are gaining momentum in PNG, and I think that's a key opportunity for us, is to tap into those, see what sort of services we can provide and be part of that bigger picture with the government and other communities in different regions.
Perhaps one final comment is one of the reasons why we established BHP Billiton Sustainable Communities in our charitable institutions was in recognition that our local operations and assets just simply didn't have the capability or the capacity to look at those broader scale, further reaching type programs. And I think the reference I made both to the PATH project and also our donation to the Global Fund is recognition of the ability to partner with government, with the Global Fund and with other larger scale organisations to support the sort of activity that's required in terms of health system strengthening and a more sustainable approach. So I think we're all aligned with that thinking.
Okay, thanks. I'm going to go to the middle mic on this side, but if you could try and keep your questions very short. There's quite a lot of people wanting to ask questions and not much time left, so keep your questions as short as possible, please. Thank you.
Sure. I'm Mike Frick from Treatment Action Group in New York, and my question is for Dr. Brink and builds off the first question about if you can say a little bit more about how Anglo-American envisions its role in TB and HIV research. I understand you have a kind of agreement in principle with ARIS to conduct future phase 3 trials of TB vaccines in the mines, and I'm wondering what that agreement looks like. Do you see Anglo-American providing financing? Is it a matter of allowing employees to become clinical trial participants? And if so, how do you ensure their meaningful participation in the research through mechanisms such as community advisory boards?
Indeed, we're really at the memorandum of understanding stage of developing a partnership, which is simply committing to work together. All the issues of financing will come into question. And then being involved in the community, which is both mining workplace and peri-mine. And as you rightly say, community advisory boards are a huge part of developing vaccine trial sites, and it takes a long time. So now is the time to start working, even though the vaccine candidate is not available for testing. But it's a very delicate and sensitive issue, but we need to show willingness to partake in that. On the HIV side, some of the big issues for us and on TB are around case detection, finding all the cases, getting on treatment, and then ensuring adherence. Adherence to treatment is probably the single biggest issue we have around HIV and TB. And we think that these information systems that we have put us in a position to really get on top of that and leave no one behind.
Thank you. Lady in the middle mic over there, please.
Hi, can you hear me? Is that okay?
Yeah.
Hi, my name is Renata Maris. I'm a PhD candidate at the University of Queensland. And my question is a bit different, and it relates to, I guess, different country context. So how does the wonderful work that you have presented in the developing setting might translate to affluent or developed countries in addressing HIV? Some of the programs that you've presented addressing HIV/AIDS, and whether this is a concern or a thought that has been discussed. Thank you.
Would anyone like to address that?
I think some of the learnings that we have is around communication in particular, with the workforce being sensitive about that communication and helping just to break down any stigmas associated with being tested. I think that is one of the key learnings that we can then transfer to some of the operations that we have in other regions where there is perhaps better medical services, better access to some of those services, but we still want people to recognise the value that they offer and take them up and use those services. So that's one of the things I think where we can transfer some of those learnings.
Okay, next question from the microphone on this aisle right at the back, please.
Hello, my name's Mark Hayes. I'm a medical student from the University of Melbourne. First of all, I'd like to say that I have no doubt about the great work that all of your companies have done for the workers and the local communities. And I have no doubt about the great intentions of the people on the panel here today to achieve that kind of work. But I feel in this topic, there's a bit of an elephant in the room. And I feel that element is climate change. So climate change has been revealed by The Lancet to be the greatest threat to global health of the 21st century through water scarcity, food scarcity, migration, violence, and destruction of healthcare infrastructure. Climate change threatens global health, including the fight on HIV and AIDS. So I was wondering, when we have companies that actively try to undermine climate action, how do we reconcile this difference between helping local communities on one hand and undermining global action and global health secretly on the other hand?
Thank you. Rob? Ben? Ben. Rob first, then Ben.
Yeah. Mark, I'm not aware in terms of what you're alluding to there in terms of undermining the process. I guess with respect to BHP Billiton's approach to climate change, again, without wanting to duck the question, that's absolutely outside of my portfolio to be responding to, and I don't feel comfortable to be asked, responding to that. My background's a health background. So I don't mean to duck it, but it's just really outside of my portfolio to respond, so I'm afraid I simply can't answer that question for you.
Mark, from my side, I would contest that we actively undermine climate action. If you go to our website at angloamerican.com, you will find a whole lot there on what we're doing to support all the initiatives around protecting the environment, particularly around water and energy consumption, particularly around the clean burning of coal and so on. We can't be perfect, but there's certainly, we don't undermine efforts to protect our environment.
And I think from an environmental assessment point of view, I think the last 1 year has really helped to bring probably HIV, health, and environment actors at country level in beginning to think about how do we better understand the whole issue about climate change and health, and what are some of the avenues for us to be able to begin to interrogate these issues. And I think for me, in the 8 countries that we're working with, this is one of the emerging achievements in terms of bringing people together and getting them to begin to interrogate and see how climate change and health and HIV and all of that could be addressed in a more predictive way through environmental assessments. And hopefully, that kind of conversation can continue. And once they continue, hopefully, it will lead to some practical actions on the ground.
Thank you very much.